I really am here in an indirect way because of the two most famous volunteers that the American Cancer Society ever had, Mary Lasker and her husband, Albert. So Mary Lasker was a champion for cancer research, and she was one of the first to really say philanthropy should support research, and volunteers should support research, and fundraising should support research. That was a foreign concept. I'm also here because of her husband, in a negative way. Her husband was the father of modern advertising in the United States. And back in the 30s, he realized that women didn't smoke, and that was a huge unmet market. And so perhaps his biggest professional success was to develop the campaigns that encouraged women to smoke. One of those was my mother. And 30 years later, when I was in high school, she developed lung cancer. She died shortly after I graduated from high school, but she gave me, as my high school graduation present, a stethoscope, because she wanted me to be a doctor, and she knew she wouldn't be around to see that happen. So I've kept this stethoscope for now more than 40 years as a reminder of why I'm here and why I work for the American Cancer Society. So I run a large cancer research center. We also have a mission of patient care, and the ACS impacts what I do on a day-to-day basis. There are a couple of really important examples. One is Hope Lodge. We're very, very fortunate to have a Hope Lodge just around the corner from my cancer center. Another area that's incredibly important is in the area of research. One of my missions is to help train the next generation of cancer researchers. And we are very fortunate to have an ACS institutional research grant at our cancer center. And we use those funds to get new investigators, junior faculty, up and running in their research careers. And that's just critical. It's so hard for someone who's new to cancer research to get external funding, and the funding support that we can get from the ACS institutional research grant is a huge lever for people to move their careers forward and really start to make important contributions in cancer research. I now have, I think, a much greater view of the society nationally and its role nationally. And I've really enjoyed that part of it. I enjoy very, very much working with Chris Hansen and the folks in ACS CAN. We've really been involved in very, very important ways in national legislation and health policy. And I think that it's all the result of what the volunteers do on a local level, that we have that kind of influence nationally. The unified voice of the ACS is more critical than ever. Cancer research funding is under threat from the administration. Healthcare is under threat in many different ways. And ACS has to speak with a loud and clear and authoritative voice to make sure that the important changes are made so that people have access to care, to make sure that funding for the research that will prevent and cure cancer continues. We've made huge progress in the last 20 years. Cancer mortality has declined steadily since early 1990s. I think with the new technologies that are coming out, the new treatments that are coming out, it's a completely different time and a very exciting time, more exciting than any time I've been involved as an oncologist. I've been doing this for 30 years, and I'm seeing things today for my patients that I wouldn't have dreamed of 5 years ago. And so I think if we extend that another 20 years to 2035, the future is very, very bright. But ACS is going to have to continue to lead that. It's going to have to continue to put pressure on every front to optimize what we do with prevention, to optimize what we do with screening, and to develop these new research-based techniques, treatments, diagnostics that are going to reduce cancer mortality even more dramatically.